And if you're able to do so, please use *6 to mute and unmute your phone. Joining us for today's media briefing are Stephanie Smiley, the interim state health officer and administrator of the DHS Division of Public Health, and Major General Paul Knapp of the Wisconsin National Guard. We'll begin the briefing with remarks from Stephanie Smiley.
Good afternoon, and thank you for joining us today. My name is Stephanie Smiley, and I'm Wisconsin's interim state health officer and the administrator of the Division of Public Health. And I'll be starting with the numbers for our media briefing. And unfortunately, it's not the news that I want to share with you all. Today, there are 1,117 new confirmed cases of COVID-19. That brings our total confirmed cases in Wisconsin to 44,135. Our total number of deaths is now 859, which is an increase of 13. This is the largest single-day increase in new cases Wisconsin has ever seen, and it's a good reminder that each of us needs to do all we can to stop the spread. We can stay at home as much as possible. We can practice physical distancing when we have to go out. We can wear a mask or a cloth face covering, and we can wash our hands for at least 20 seconds. We can get tested if we have symptoms or have been exposed to COVID-19. As a reminder, here are the symptoms you should watch out for: a cough, shortness of breath, fever, chills, sore throat, runny nose, muscle pain, headache, and the new loss of taste or smell. While these are the most common symptoms, some people also experience fatigue, nausea, vomiting, diarrhea, or abdominal pain. Again, if you're experiencing any symptoms or if you've been exposed to COVID-19, please access a test. It is one very important way you can help stop the spread of COVID-19. Thank you, and now I'll turn it over to Major General Knapp for an update on the Wisconsin National Guard.
Thanks, Stephanie. Good afternoon, ladies and gentlemen. I'm Major General Paul Knapp, Wisconsin's Adjutant General. It's always a pleasure to join you for this briefing, and I'm grateful for the opportunity to speak with you all today. We crossed a major milestone in the last few days with over 250,000 COVID-19 tests administered across the state. That's really an incredible number when you stop to think about it. Our troops continue their hard work across the state, and more than 1,000 continue to support the state's efforts in the COVID-19 response. It's hard to put into words what a monumental lift this pandemic has been for our citizens, soldiers, and airmen. They make it look effortless, but let me tell you, it's been truly incredible effort behind the scenes. And our troops have sacrificed a lot to help fill the state's needs since this all began. Our first troops reported to state active duty March 12th to support Wisconsin's response to the pandemic, and they've been engaged every day since then in an effort to serve you, their fellow Wisconsin citizens, neighbors, families, coworkers, and friends. It hasn't been an easy road, and the response has grown over time. And frankly, our state has asked a lot of our Wisconsin National Guard, and our troops have risen to the challenge in every sense of the word. I simply cannot praise them enough. Many left their civilian employers to answer the state's call for help. Others put college plans on hold or even tried to do both simultaneously. All have worked long days and late nights, sacrificing time with family and loved ones. When this all began on March 12th, none of us knew where this would go or the role we would ultimately play. But our troops still volunteered to help, and they remain on the job as dedicated as ever. And they'll be here to support our state as long as needed. As Wisconsin National Guard citizens, soldiers, and airmen, we are, after all, your neighbors. We're invested in Wisconsin because we live and work in the same communities which we serve. We have two primary roles, serving both as the state's first military responder during emergencies such as COVID. And of course, we also still have our federal mission where we can be called to deploy overseas as the primary combat reserve for the Army and Air Force. Since March 12th, we've peaked at more than 1,400 troops mobilized in direct support to the COVID-19 response, fulfilling a variety of roles ranging from the ongoing specimen collection mission to helping staff isolation facilities and man a warehouse moving critical PPE around the state. We simultaneously mobilized an additional 2,400 troops to work as poll workers during April's election and another 160 during the spring election in May. We've done all of that on top of the hundreds of Wisconsin National Guard members who continue to serve around the globe in places like Afghanistan, the Middle East, Ukraine, and the Horn of Africa. I'm just so proud of the admirable way in which our troops have responded and continue to respond. We always stand ready to serve this great state and nation because this is who we are, and it's why we wear this uniform.
Thank you. We'll now open it up to your questions. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. And we have time today for one question and a follow-up. And we'll begin this afternoon with Jonathan Nizer from NBC 26. Jonathan?
All right. Just wanted to ask if the National Guard anticipates being called in any way to assist with schools as they, in some cases, attempt to reopen.
Hello. In terms of schools, that's a good question. We have not been asked at all yet to assist with reopening of schools, but like any of the other missions that we hadn't planned for in terms of the COVID-19 response, we would be ready, willing, and able to help if that would become a requirement for opening up schools in the state.
Have a follow-up, Jonathan? Okay, thank you. Moving on to Brandon Arbuckle from WISC TV in Madison. Brandon? Again, Brandon Arbuckle from News 3. Okay, we'll move on then to Scott Bauer from the Associated Press. Scott.
Hi, thanks for doing the call today. Can you tell us how many tests there were that came back negative for today, and where we were in percentage of positive tests? And also this new high number, the 1,117, do you have any demographic information? Are we talking people in their 20s again, like we've seen in this recent spike? Is it a new population? Just a little more context on these numbers.
Sure. All of our numbers are posted on our website at 2 p.m. But what I can tell you right now that I have in front of me is that the negative results that we added since yesterday's total is 13,371. And then in terms of the demographics, we are, let's see. I wouldn't necessarily have that information in front of me at this moment, but yes, we are definitely seeing increases in the younger populations that are testing positive.
And a follow-up, Scott? If not, we'll move on then to Sean Kirkby from Wisconsin Health News. Sean? Again, Sean Kirkby from Wisconsin Health News. And a reminder to press *6 to mute and unmute your phones. We'll move on to Denise Lockwood from Racine County Eye. Denise?
Thanks for taking my call. What I wanted to really understand is the decision-making process. I know that the Wisconsin National Guard has to be invited, but how does that process actually work with regards to the overall decision-making with where they go and how much the need is as far as determining where they go?
Okay, great question. So in terms of prioritizing testing and where the National Guard, where we respond with our community test sites, has to do with the priority level and what type of a test site is required. So I'll give you an example. So we have outbreaks, generally in like long-term care facilities, nursing homes, congregate care facilities, that sort of thing. An outbreak in a facility like that would be a high higher priority than a routine community testing site. So when all of these requests come into the State Emergency Operations Center through Web EOC, through the county emergency managers, every day our State Emergency Operations Center manager he basically puts all of those requests that have come in that day, and then they go to a policy group, which is made up of the governor's staff, DHS, DOA, State Emergency Operations Center, and DMA, which includes the Wisconsin National Guard. And we have a meeting every day to go over those requests, and if we have to prioritize them in terms of timing, then that's what we would do. And we would prioritize the more time-critical test sites first in terms of scheduling. Right now we have the capacity to meet all of the demand out there to test everyone who needs to get a test in terms of community-based testing. And so it does come down to a matter of just scheduling after that in terms of process.
Thank you, Denise. Moving on to Shemaine Mills from Wisconsin Public Radio. Shemaine? Shemaine Mills from Wisconsin Public Radio. And we'll move on then to Stephanie Hoff from WIS Politics. Stephanie? Stephanie Hoff from WIS Politics. Okay, we'll move on then to Riley Viderkind from Wisconsin State Journal. Riley.
Hi, thanks for taking my call. My question is probably for Stephanie. If you could implement one or two statewide regulations to help deal with this virus, which would those be and why? I guess I'm thinking of, if the legislature were to come back at some point, what do you think would be, a couple of the most important statewide regulations that would be effective to try to bring the numbers down? Thanks.
Sure. It's an interesting question because, I think that what we have, understood throughout this response is that in Wisconsin, a lot of that decision-making authority has been at the local level, right? And so we have seen across the state that there's been advisories issued as well as requirements issued for masks and cloth face coverings. And we've also seen our business partners and our business communities really also instituting their own policies, for their patrons and customers to help keep not just their workers safe, but other people, who may be frequenting those businesses and facilities. And I think that, what I would say to that is that we have very few tools that are available to us in order to, really slow the spread of this disease. And one of the ways to do that really is by wearing a cloth face covering and physical distancing. And so, I think that any chance that, folks can, do the thing the responsible thing, it is, really, we believe that is the duty of people to protect themselves, protect others by physical distancing and wearing a mask. And, we certainly want people to make those choices. And that is the way that we would protect people.
Thank you, Riley. Now to Molly Beck from the Milwaukee Journal Sentinel. Molly?
Hi, thanks for this call. The Dane County Health Department is saying they are about 10 days behind in processing negative tests. And I'm wondering how many health departments in the state are experiencing a backlog like that of processing negative tests and how that's affecting the daily percentage of positive tests that's reported each day.
Yeah, it's a great question, actually. And I would say that because, of the numbers that we're seeing every day, the thousands of results that are reported to us, we are seeing backlogs, and and I would say that particularly counties that are getting harder are they're going to have obviously where there's more results being reported, and there's folks that need to process those results and have them inputted into our system. And so there are definitely backlogs of data, but there are thousands upon thousands of results processed each day, and so I would say that is a reality that is facing many local health departments.
And a follow-up, Molly? If not, we'll...
Yeah, could you...
Go ahead.
Sorry about that. Could you tell me how the virus activity right now in the state compares to the virus activity in March when businesses and schools were shut down?
Yeah, so what I will say is that we're not really able to compare apples and oranges because the tool that we currently have available, and the metrics that we're using did not exist in March, so we don't have a direct comparison. But disease activity level across the state is high, and it is high in most of the counties in our state. And when things were shut down, you can imagine that disease activity was much lower. We had many lower, at least lower spread that we were able to record because, as you know, when you're out and about and things are open and people are gathering, and the science has since evolved, about cloth face coverings. It was, a different time, and we're definitely seeing higher disease transmission, higher disease activity now than in March, and a lot of that can also be seen when through our contact tracing, many people are reporting more contacts now than they had been back in March when that contact tracing was happening. So they may have averaged 3 to 5 contacts, and we're seeing people who are reporting upwards of 15 to 20 contacts when they're being interviewed. So I would say, that is, we're definitely seeing higher activity, and, through many different metrics that we monitor.
Thank you, Molly. Now to Courtney Garish from Spectrum News. Courtney? And a reminder, *6 to unmute your phone. Courtney Garish from... Are you there, Courtney?
Hello, can you hear me? Sorry.
Yes, we can.
Okay. So I was jumping off the increase in cases that you're still seeing in the younger population, the positive cases, and then the hospital rates are now, you're seeing a really high average in those. Before age group was starting to spike, the hospital rates and the death rates weren't going up because along the lines of the younger generations don't have the same type of severe illness, not as many deaths and not the severity of illness. So how do you correlate that now with the hospital rates going up? What is that indicative of?
Sorry, it took me a minute to get my unmute button. Yeah, so I think that what we're seeing is that definitely seeing more patients hospitalized as we go, and I think that that's just sort of unfortunately, the course of this illness, people do become hospitalized, and we start seeing the case numbers go up. We're going to anticipate that we're also going to see more hospitalizations. It does take there is a delay typically, certainly, between, can be between the time that you are diagnosed, and end up needing, additional care. So, that I think that we're just seeing additional cases, which we can anticipate, unfortunately, more hospitalizations as a result of this disease.
And Courtney, do you have a follow-up?
Switching to schools, a lot of schools are going to be in session 5 days a week and in classroom. Is there any way to prepare for, or do you anticipate what kind of a spike we're going to see from that exposure?
Sure. It is actually really hard to anticipate what we might see. And I think that that's part of the challenge that we're faced with when, trying to figure out the best way forward with reopening schools. Our department continues to work with the Department of Public Instruction and local health departments, to provide guidance and recommendations for school districts. And it's hard to sort of anticipate, well, what is the disease activity level going to be this fall? Unfortunately, if we continue to see the trends that we're seeing right now, it's not probably going to be in a good situation in the fall either. We have been and we continue to monitor and analyze the data to help school boards and school administrators to make decisions in consultation with their local health partners. But enough is not really known about transmission in schools, what that means to be able to really anticipate what that disease activity level is going to be as a result of school coming back in the fall in some instances. So it is really a quandary, to be sure, and we obviously are going to need to pay close attention this fall and make decisions accordingly.
Thank you, Courtney. Now to Aaron News Milwaukee, Fox 6 Milwaukee. Aaron?
Hello, thank you for this call today. Really a follow-up to that question you just answered. What is your message to school districts and also school administrators and parents as we're learning more about these reopening plans right now?
Yeah, I think that the bottom line is that, we're continuing to work, and it is really difficult, again, work to sort of anticipate what the situation is going to be like in fall, and understanding that decisions need to be made now about, how people can proceed in the future. So working with our colleagues and our partners at the Department of Public Instruction, as well as local health departments and, school administrators, to come up with the best plans that we can to help keep students and their and teachers as safe as they can throughout this is really the goal. We will again continue to monitor the situation and revisit these conversations. I don't think that it is a situation where you would make a decision and be one and done, because as we have done throughout the entire response, is that you learn as you go. We have no playbook that has been written, for this disease or for this response. Certainly, we can leverage, pandemic plans and influenza, lessons that we've learned, from those situations. But this is very different, and it is something that we're going to have to, see how it goes and learn, as time goes on throughout this pandemic. So I think what I would say is, we have to keep talking. We have to keep, monitoring and be willing to, sort of come together and, keep those lines of communication open.
And did you have a follow-up, Aaron?
Yeah, do you have concerns about schools reopening in the state?
I think that my concern is focused